Good morning, Illini. Welcome back to a Healthy Illini podcast. I'm your host, Matt Schrock, as always, and we're glad you're with us. And we're excited. We're getting ready to start the semester, this fall semester. And so we want to kick it off with some conversation about McKinley specific and things we do here. And I'm glad you're joining us for that conversation. Today I'm joined by our executive director here at McKinley Health Center, Awais Vaid. And Awais, thanks for being with us on the program again.
Thank you, Matt.
And you're starting, this is your third academic year here with McKinley, I believe, as director. So you've figured out a little bit of your footing and the personalities that you're working with. And so is there a little bit of a different feel going into this third year for you as a director?
Just a little bit. I still feel like a newcomer. It takes a while to really understand the campus community. And I think also, the campus demographics are changing. So it's always a learning opportunity. I love this time of the year just because we are anticipating so many new students coming on campus.
Well, and it's kind of like, your first year for anybody who works on campus, your first year is such a whirlwind because you're just learning so much. And really, that's the way it is for our students, too. When they come on campus, it's that whirlwind of trying to figure everything out really quickly. You're thrown in the deep end. Everything happens at the same time. It happens really fast. And so that start of an academic year is fantastic. The energy ramps up. It's exciting, but it's a little bit of a tiger by the tail that it takes off and you're just kind of hanging on, trying to survive that first few weeks. And so as we're going into this new semester, this new academic year, one of the things I wanted to do was have this conversation about things that are happening at McKinley, some of the new things that are happening, some of the new developments that students may not be as aware of because they're getting inundated with so much information from the academic side, from the student life side, from the health care side, health and wellness. All of that comes at once, and it's really just an onslaught on that. And while we feel the excitement here at McKinley as well, and we prepare to serve our students in a healthcare as taking care of their illnesses and things like that, the other thing we're really passionate about here is teaching. Not as like a teaching hospital kind of thing, but like helping students learn to be adults, to grow, to what it means to step into this autonomy of life that a lot of them are first time stepping into. And so we try and encourage them to understand healthcare. And one of the things we're going to talk about here is the term health literacy. And I'm going to ask you about that. But also something that we focus on at McKinley is to say, for students at UIUC, start your healthcare journey with McKinley. So my first question is, would you share a little bit about why that's so important, why we say start with McKinley, and kind of what health literacy is and our role in that?
Sure. So first, let me again thank you for inviting me back on the podcast. It's always wonderful to be able to have this conversation one-on-one. Just as an example about health literacy, you and I have been in the healthcare field for a long time. And even though we are in the field, we also know that the healthcare system is very complex in the United States. And even for us who have been doing this for a long time, it can be a challenge navigating the healthcare system for ourselves or for our family. So I do know that, for a student who's coming to this campus first time from either a different state or a different country, where they were either taken care of by their parents or by themselves, but in a completely different system. Mm-hmm. And now you are all alone by yourself, and you are an adult. And so you are trying to navigate the healthcare system by yourselves. It can be challenging, it can be confusing, it can be daunting as well. So for us at McKinley, we want to be one of those, confidants that as a kid, your parents were always asking your pediatrician if you had any healthcare concerns. They probably had their phone numbers stored, and they could ask them or text them or call them any time of the day for any concerns. On campus, we want to make sure that students feel the same about us. So if they have a question about their own health, if they have any concerns, then they should start their journey, their healthcare journey, simple, complex, any of those, at McKinley Health Center. Every single student who's registered for 6 or more credit hours is paying the health service fee. So you are prepaying for these services. Might as well use it. So if you have something simple like a cough or a cold, if you want to get a physical, if you want to get your labs done or your x-rays done, start at McKinley. 95% of the times, whatever conditions, whatever problems you have will be taken care of right here at McKinley by our providers and by our labs and by our pharmacy. The 5% of the times when you may need something more, something which may be more complicated, our providers will be able to help you navigate that journey as well. If you need a referral to a specialist, if you need to be sent, whether in a community or somewhere else, our providers are experienced in doing that, and they can help you much better. All we do is student health. We know student health better than anybody else. So might as well use us for that purpose.
And that's an important distinction, that we don't take community members, we don't take faculty and staff. It is purely students is what our focus is, and that's what
purely
we're here
students, and we keep retraining our staff to make sure that they understand what the student needs are. We keep training them and retraining them again and again, because the needs of the students change as well. Their expectations have changed, and so we take a lot of effort in making sure that our providers are also understanding the student needs as well as what is being offered in the community.
And that's something, you talked about. It can be daunting, it can be uncertain, that it's when something happens, if there's an event, an illness, whatever, there's all kinds of emotions, there's all these feelings you have, and if you haven't had those conversations, it's even harder sometimes because it feels really overwhelming. So what I'll tell students a lot of times is, if you have a question, ask. Whether it's something you're dealing with now or you think you might deal with at some point, ask, because that's what we want to do, is try and help you understand what your options are, how to navigate it. So hopefully it doesn't happen, but if you do have a medical emergency, you have that knowledge that you can fall back on, and that's where we're here to help in those types of situations. That there's no question that we're like, you shouldn't ask that question. Ask all the questions, and we'll answer as best we can.
Right, and our spaces, our location is available 6 days a week, right? Monday to Saturday, we are here physically open, but we are also accessible 24/7. We have a nurse line that is available when we are not open, and you can always send messages through your portal, where you can probably get an answer by one of the providers or the nurse who's part of the team. So there are multiple ways of getting in contact with us. Ideally, you want to be seen by a provider here so that they can assess what the needs are and then make the best decision on how to treat you or to refer you out.
Before we go on, just very briefly, we've done other podcasts on this, but I do want to touch on it in this one. And when we say the services we provide a large number of services for a facility our size, but also for college health. There's not many other college health centers that do all the things that we try and do. Would you share just a little bit the services that students can find here, just as a general overview?
Absolutely. So McKinley Health Center, for being an independent health center not connected to a hospital, we are among the very few in the nation that provide so many services. Our primary care department have board certified physicians. We have quite a few of them. We have nurse practitioners, PAs, but we also have specialty clinics for women's health and for mental health as well. And in mental health, we have a great psychiatry team that can prescribe, and therapist on staff as well. Appointments in our mental health can be made within probably a couple of weeks. And if you have any idea of what time it takes in the community to get an appointment, or even other campuses, you'll be shocked to hear that it can take anywhere between 3 to 6 months, even 9 months, to make an appointment with a psychiatrist. That's not the case at McKinley. Plus, when you're at McKinley, you don't have to go out to get your labs done. You don't have to go out somewhere to get your pharmaceuticals filled up, or for an x-ray. All of those things can be done in-house while you are here. You can get done with your appointment, and immediately after that, you can go and get your labs done, and then your x-rays if you need to have it, or your prescriptions filled. So it's a one-stop shop, pretty much encompassing all of those things. Additionally, we also have other wraparound services like our physical therapy, athletic therapy, as well as clinical massage. These are services that you would have to go to multiple different locations in the community or somewhere else, and wait for weeks and months to get appointments to. At McKinley, all of these things can be done in the same location and within days of each other.
Even like Carl Hospital, which is one of the larger hospitals in our area, if you go to see them for something, you may end up going to multiple locations in the town just for that. They're not even one-stop shop, one area. And so you're right, that's a really unique thing that we have advantage to here.
One other thing I'll also mention, along with all of the services that we provide for taking care of students, we have a health education department that has been in existence for a very long time. And we do a lot of services which could be one-on-one appointments, whether it's for stress management, for dietetics and nutrition, but also a lot of outreach to prevent. And that's a big focus of our health education unit as well. Now, the health education unit have professional staff, but we also have, along with professional staff, a lot of students who function as peers, wellness peers. And, they are amongst our students. They know the student population best. So we recruit them, we train them, and then they become our ambassadors on campus to talk to other students and also to, table at different events, go and speak at different classes and other units and other places as well.
So that's a lot of services. That's a really robust offering that we have. And when we go to other conferences or talk to other universities, there's oftentimes people like, you really do all that? And they're kind of shocked by it because that's not always the norm everywhere. But at the same time, we don't just sit back and say, we're doing great and just stay there. We're always looking for new ways to improve, new ways to reach our students, new ways to be on the cutting edge of things. And so I want to take a little bit and talk about a couple things that students can find this fall that they may not be aware of, that are things that we're focused on, trying to expand some new things. And you actually mentioned one of them, so I'm going to start there. When you mentioned our sports and rehab and therapy, we've had a physical therapist, we've had an athletic trainer for a long time, but one of the newer positions that we have is that clinical massage therapist. Would you share a little bit about what that means?
Sure. So one thing I'll mention is that, as a clinic, as a clinic on campus, on a large campus, you never want to become complacent with what you do. Yes, you want to make sure that the services that you provide are the highest quality of services. And that's always the baseline. But along with that, you have to grow and you have to change, keeping in mind what the student requirements are, needs are, demands are. And so we always, on an ongoing basis, engage with our student population, whether that is through our advisory board or whether it is through one-on-one with students, or in groups where we are meeting with them, talking to them across campus.
Well, and that's one thing that's wonderful but challenging on campus, because we get a brand new set of students every year that have new expectations, new experiences, and then you think, you have no one more than usually 4 or 5 years. So we need to be looking at how to serve them, because it's a totally different demographic every single year that comes through.
And that's why you have to keep engaging with them on a regular basis. It's not like once and done. You cannot just do this once every 5 or 10 years. You have to keep doing this every semester, not even every year. And so one of the things that came out of that was a need for clinical massage therapy. Now, let me just be clear, this is not recreational massage. So if you're looking for something recreational, there are other providers in the community, off campus, even on campus, that provide that. Clinical massage complements our physical therapy and athletic therapy. And this can be only utilized if there is a referral from one of our providers in the primary care or in our specialty clinic. We found out a significant need for our providers who are referring patients outside for getting clinical massage. And so that was one of the things that the students requested, and our providers saw a need for that as well. So that's an expansion that we have done in the last few months. So I encourage people, again, if there is a need, talk to your primary care provider at McKinley, and if there is justification for that, they will refer you for clinical massage in-house. And again, appointments can be made within a few days of the need.
Another area that we always try and be proactive in is the use of electronics, of technology, of things like that. And there's two things that we're really highlighting this fall that aren't necessarily new this fall, but students may not be as aware of them. Those two things are our mobile check-in and our self-care stations. Would you share a little bit about what those are and how they're accessed?
Right. So improving access to care is always, a priority for all healthcare institutions. The same for us as well. Mobile check-in is pretty much a simpler way of saying you don't have to come in to the building and stand at a workstation, remove your ID card, wait in line first, get your ID card out, scan your ID card at a workstation, and then answer a couple of questions to be able to go to your appointment. With mobile check-in, you can be in our parking lot, and open your My McKinley app, and you can check in within 30 seconds. And then once you're checked in, you go straight to your appointment rather than having to wait in the lobby trying to check in. So this is just making it more convenient for the student. And every single thing, every little small thing, whether it is saving 5 minutes of your time, could be important. So that's one thing that we are going to push a lot this semester. It was launched a few months back, and we have seen a steady, increase in the number of students utilizing it, and the feedback has been good as well. The other thing is our vending machines, our over-the-counter dispensing vending machines. We launched a pilot a couple years back, and that was very successful. And then we expanded 3 more vending machines across campus last year. And this initiative has probably been one of our most successful initiatives in the last few years, just because it gives more access to students to pick up pharmaceuticals that most of the students need only a limited number of things if they're not feeling well. Ibuprofen, Tylenol, a cold pack, a wound care pack. Along with that, things like Plan B. These are all products that are available at no extra charge to students every semester. And we have strategically placed all of these vending machines across campus so that students don't have to walk miles or have to drive off campus to go and pick up some of these products if they are in a need of this during an emergency. We also partnered with our local public health and have added Narcan, which is overdose prevention drug, in all of these vending machines as well. Since we've launched that program, we have dispensed about 2,000 Narcan kits to students across campus. That has been very successful as well. So again, trying to improve access with the use of technology and making it much more physically accessible for students through vending machines.
And that's because one of the things that students have said a long time, and we're going to talk about it a little bit more in a moment, but is expansion of our locations. That it'd be, if we're in we're on one corner of campus, but if you're on the opposite side, like over on Green Street, it's tough to get to us sometimes. So having these self-care stations helps that coverage, because we have 4 right now. One's at SDRP, one's at the Illini Union, one in Granger Library, and one in ACES Library. So because of that, we've seen that we've been able to serve students, like they're walking between class or they're out studying late or something like that. They can get those over-the-counter products at a moment when they might need it, when before they might have had to come to us or they'd had to go purchase it somewhere. So it really does, again, it's us trying to serve our student body as best as we possibly can, use the resources we have available, use the technology we have available, and be really proactive in that. It's interesting because, as a side note, as there's a lot of campuses that are trying to figure this out now. There's a lot of places they're trying to figure out how to do vending machines, and they're asking us. I was at a conference with you actually in the end of May, and there was a presenter there talking about vending machines, and they were sharing their info, and they said, "Where are you from?" And I said, "University of Illinois." And they stopped. They said, "Okay, we have questions." So it went from them giving information to asking how we do it, because we've had this program. And so I do hope students take advantage of it, because it's really something that is a lot of places are looking to do it, and we've seen it being done well here.
Right, and I also mentioned, we currently have 4 vending machines, but we have plans on expanding even on those as we study the viability, sustainability of those vending machines as well, and the staffing needs as well. Big kudos to our pharmacy department that have taken this project on and have done a wonderful job of keeping these items stocked up for the students. So it's a lot of work. We know that, but we also know the benefit is tremendous. And so look forward to more expansions of the vending machines in the future as well.
And as you're talking about, expanding and looking towards the future, let's segue a little bit to some plans in the future. One of the things, again, that students talk about a lot is, do you have other locations? We've talked about looking for other locations, and it's starting to look like a second location might be in the near future. Would you talk about that a little bit?
Sure. So, we have a wonderful location on campus already with all the services within the same building. But as the campus has grown, as the needs of the students have grown, we also feel that a second satellite location, more central to campus, would serve the students even better. Not every single service, but urgent care services, a flu or a COVID or an injury or something of that which needs urgent attention could be something that we can provide at a satellite location. So there has been discussions around this for multiple years, even before I got into this position. But we are getting to the point right now where we are finalizing plans to establish a satellite clinic somewhere in the heart of campus. And again, plans are preliminary right now, so I don't want to speak too much about it. But my expectation is that within a year, we will be able to announce a satellite location in the heart of campus with easy access to students for urgent healthcare needs.
And again, that just goes back to we are here to serve our students. We are passionate about serving our students and passionate about finding new ways and opportunities that are in the campus. We're not just sitting back on what we've done, and we've done a lot, but we're being intentional about finding those opportunities.
You don't want to get complacent. You want to keep looking at improving what you are doing, and this is one way of doing that as well.
But we have done a lot. And that brings us to a little bit of a milestone that we have coming up this fall. McKinley, in this fall, we're kicking off, we're celebrating our 100th anniversary. And there's not many units on campus that can say that. It's interesting that it kind of is going to align with a DIA 100th with Memorial Stadium and all that. But we are celebrating the 100th anniversary of McKinley Health Center. And so what does that milestone mean for McKinley and for the campus?
So 100th is a milestone. It's just a number. If you look at it, 50 years, 75 years, 100 years, it's all significant. What is important is the 100th anniversary will give us an opportunity, us in the sense McKinley and the campus, to talk about the significance of McKinley over the last 100 years. How has this unit on campus played a role in student success, in not just for the students. I mean, we are only for students, but how does this impact the community at large as well? Having a specialty student-led health center on campus is a significant impact on the community at large as well. We are not burdening our hospital system, our healthcare system, because we take care of our students here. We give easy access to our students to be able to come and see us within hours or days of when they need us. So this event will be our opportunity to tell the story of how we started 100 years back as a hospital which was primarily focused on infectious diseases at that time, and how we have changed with times and with changing demographics and changing students to where we are right now. Along with that, we also will be able to tell our story of where we intend to be in the next 10, 15, 20, or 100 years. So it'll be significant for us. Look out for different events that we will be holding throughout the year next year, and encouraging everybody who has not come to McKinley to come and take a tour of the place and learn. We will be having different exhibits across campus as well, which will talk about our history and where we started and where we are today.
And I love that you mentioned that it's not just the health center here, but how we interact with the community, how we interact with the campus, because that's another thing that we're really trying to be even more intentional. We've always done it, but being more intentional as of late is those collaborations, those opportunities to utilize services that other units have on campus instead of us trying to reinvent the wheel. But at the same time, them understanding what we can do for them so they don't try and duplicate the same things we're doing and have those collaborations, because when we're stronger together, we can support the students more directly. And that's something that we're really passionate about here at Healthy Illini, is we've tried to connect with other units in order to build those collaborations, in order to build those relationships so that we can help each other, help the students, and continue to be a really cutting edge campus, a very forward thinking, a very proactive campus for our students in their health and their wellness and everything that impacts as it goes. We're almost out of time. I do appreciate you taking the time to talk about these things. I know as we're starting the semester, all our schedules are getting a little bit more hectic. It's a huge energy shift as we get into that, but I'm really excited to see what this year will bring, as we've seen a build over the last couple years, under your leadership especially, seeing some really positive things happen, some exciting things on the horizon. And so I just wanted to say thank you for coming on and talking about it today.
Absolutely. Thank you.
Here on campus, if you're a student on campus, McKinley is here to serve you. You've already paid for the services through your tuition and fees. We have some other podcasts about that. Go back and check through our items. You can see things about McKinley specific and also about general health and wellness. We have just a huge variety of things for you to listen to and learn from, because we're here to support you. We're here to help you find your path to navigate through healthcare, to navigate through your time here on campus. And so if you have any questions, if you have any concerns, contact us here at McKinley. If you're just not sure what questions to ask, even, that's an okay one. What do I need to ask about how to navigate healthcare? We can answer those questions as well. But we want to come alongside with you. We want to be a resource for you for your time here on campus, especially, so you can build those healthy habits and build those healthy practices as you go out and find whatever path is here for you. But thank you for joining us today. You're on a personal journey no matter where you are in it. You are important and you matter. Your health and wellness are important and matter, and we're here to keep you well to excel. So go have a great week, Illini. Let us know how you're doing, and we'll catch you next time on Healthy Illini.